Okay, I'm trying to see who ready to save some lives right now. At the very least, someone's quality of life. All right. Let's talk about strokes and what you can do to help somebody out in a stroke and identify a stroke. All right. So, what is a stroke? A stroke is an emergent situation. All right. This person needs to go to the hospital right away. There are two kinds of strokes that could be happening with this person. All right. They may have an ischemic stroke or a hemorrhagic stroke. An ischemic stroke means there's some type of blockage somewhere in the vessels of the brain that's causing a decrease of blood flow to a certain part of the brain. All right. A hemorrhagic stroke means there's a bleed somewhere in the brain. Now, hemorrhagic strokes are only about 15% of all the strokes that happen out there. So the likelihood that you'll come across this is not as much as an ischemic stroke, okay? Now, there's an acronym that we use in healthcare to help us identify strokes, and that acronym is BFAST, all right? Balance, eyes, face, arms, speech, and time. And all of these letters stand for something. So let's go over it. Balance, all right? Does this person have a sudden loss of balance? Are they starting to walk funny, not able to stand properly? This is the first identification that may tell you that they are having a stroke, all right? Eyes, all right? When someone's having a stroke, they tend to have trouble with their vision. They may have vision in addition to a headache, all right? Their eyes may also deviate to the side of the brain that's having that stroke, all right? So if you notice the person's both their eyes are deviating to one side, that's also an indication. Their pupil may dilate on the side that's having the stroke, okay? Now, when you're having a stroke, the opposite side of the brain that's affected is going to have the deficits, all right? So, for example, if I have a blockage in ischemic stroke somewhere on the right side of my brain, that means the left side is going to have the deficits, but the right eye is going to have the deficits for that particular stroke. It's going to be facing the side that the stroke is. So my eyes are like, oh, what's going on over here? Oh, there's a blockage over there. Something like that, all right? Think of it like that. Face, you may have a person that has some drooling. So they may have something like this going on. They may have some drooping in their face. They may have some drooling, things like that. That's one of the more common indicators, okay? And now with the deficits, this is where we talk about arms, and you can also throw legs in there, right? You're going to have weakness and numbness to that entire side. They're not able to hold it up. They're not able to grab your hands, things like that. Speech we kind of just spoke about with face, all right? So there's the drooling, there's the trouble speaking, there's the trouble understanding, all right? They may be talking kind of strange, slurred speech, things like that. And then another important one is time, all right? Time is an important factor when someone's having a stroke because there are certain medications that they may give in the hospital, specifically TNK, TPA. These are clot busting medications, all right? And these medications for most locations can only be given up to 4.5 hours of having that stroke. So one thing that's important is you need to know when was the last time you saw them in their normal baseline condition. When was the last time you saw them okay? Was it before they went to bed? Was it 2 hours ago? This is information that the EMS crew in the hospital is going to have to know upon their arrival. Okay? So again, try to keep in mind when was the last time that you saw them well. All right. Seizures and strokes can sometimes be seen hand in hand. It's sometimes rare, but sometimes you'll see a patient having a stroke and also seizing at the same time. Okay. So if you don't know which one to treat, be able to identify what's going on. And just to go over seizing really quickly, if they are having a stroke and a seizure at the same time, while they're seizing, just put them over on their left side, protect their head, move everything out of the way to protect them, and don't put anything in their mouth, all right? We're going to talk about seizing on another day, but for now, just keep that in mind in case they do happen at the same time, all right? So again, remember this acronym if you suspect that someone's having a stroke. Balance, eyes, face, arms, speech, and time. If you can identify this, you can help someone who's having a stroke and prevent them from having long-term deficits because every minute that goes by that part of the brain is not getting oxygen, those brain cells are dying and dying and dying. If you can get them the help they need and get that circulation happening sooner than later and get oxygen back to that part of the brain before those cells start to die, you can save them from having long-term deficits, okay? And depending what part of the brain that deficit is happening at depends on what kind of deficits they're going to have, okay? If it's in one part of the brain, they may have trouble with their speech for the rest of their life. If it's another part of the brain, they may have trouble walking or grabbing or seeing. So depending where it is, that's where the problems are going to lie. All right. So remember this acronym and you can help save somebody's quality of life. Okay. Or save their life altogether. All right. God bless y'all.